Rachel's heart was pounding as she stepped into the ER, cradling her arm. It wasn't just the pain, it was the uncertainty. She couldn't shake the feeling that something was off. The fall had been brutal. One moment, she was confidently navigating a rocky trail, and the next, she was on the ground, her arm throbbing and blood trickling down. She remembered the sharp sting as her skin scraped against the jagged boulder, but it wasn't until she tried to move her arm that she realized just how bad it might be. By the time she reached the hospital, her adrenaline had worn off, and the pain was almost unbearable. The cut didn't look massive, but it was deep enough to make her stomach turn when she glanced at it. And there was something strange about the swelling. Her arm felt unusually heavy, like it was weighed down by more than just the injury. Is this normal? She wondered aloud, her voice tinged with panic as she spoke to the nurse. The ER waiting room was buzzing with activity. Patients coughing, parents trying to comfort their crying children, and nurses rushing to triage the next case. Rachel couldn't help but feel small amidst the chaos, but when the nurse saw her arm, she immediately ushered her to a room. That only made Rachel's anxiety spike. Is it that bad? She asked nervously. Soon the doctor arrived, a calm presence in the whirlwind of Rachel's emotions. Let's take a look, he said reassuringly, but as he examined her wound, his brow furrowed ever so slightly. Have you cleaned this? He asked. A little, Rachel replied, but the pain got worse every time I touched it, so I stopped. Is it infected? Maybe, the doctor replied, but his tone was cautious, not definitive. We'll need to run some tests to be sure. That word, tests, sent a chill down Rachel's spine. Why couldn't it just be a straightforward cut? Why did it have to be something they weren't sure about? The nurse returned with supplies, and the doctor began cleaning the wound. Rachel winced as the antiseptic stung her skin. I'm sorry, I know it hurts, the nurse said gently. But it wasn't just the sting that had Rachel on edge. It was the way the doctor kept looking at her arm, tilting his head as if something didn't make sense. What is it? She blurted out. We'll know more after the X-rays, he said, but there was a flicker of curiosity, or was it concern, in his eyes. As they wheeled her to the imaging room, Rachel's mind raced. What if there was something serious? Could a small cut cause this much trouble? And why did her arm feel so strange? The X-ray technician was friendly, trying to ease her nerves with light chatter. But as the machine whirred and clicked, Rachel couldn't focus on anything except the possibility that something was seriously wrong. After the X-rays were done, she was brought back to her room, where the doctor was already reviewing the images on a glowing screen. Rachel couldn't see the details from where she sat, but she noticed the way he leaned in closer, his expression hardening. What's going on? She asked, her voice breaking slightly. Well, the doctor began, choosing his words carefully. There's definitely something in there. It doesn't look like bone or normal tissue. Rachel's stomach dropped. What do you mean? Like debris from the fall? A piece of the rock? Possibly, the doctor replied. But it's hard to say for sure without closer inspection. Whatever it is, we'll need to remove it. Remove it? Rachel repeated, her voice rising. How did something get in there so deep? I thought it was just a cut. Sometimes, injuries like this can drive debris deeper than you'd expect, he explained. But don't worry, we'll take care of it. We just need to be thorough to make sure there's no risk of infection or complications. The nurse prepped Rachel's arm for the procedure, and the doctor explained each step as they went. But Rachel's mind was still racing. How could a simple fall lead to something like this? Was there more to the injury than she remembered? And what if the object was something dangerous? As the doctor made the first careful incision to explore the wound, Rachel held her breath. The room was quiet except for the soft beeping of a monitor and the occasional murmurs between the medical staff. Then the doctor paused. Rachel's heart skipped a beat. What is it? She asked, her voice barely above a whisper. I'm not sure yet, he said, leaning closer. The nurse handed him a pair of tweezers, and he carefully began to extract something from the wound. Rachel couldn't see what was happening, but she could feel the slight tugging sensation in her arm. Her mind conjured 100 scenarios, each one more bizarre than the last. When the object was finally removed, the doctor straightened up, holding it carefully in the palm of his gloved hand. His expression was a mix of shock and fascination. "What is it?" Rachel demanded, her voice trembling with a mix of fear and curiosity. The doctor turned to her, his eyes wide. "You're not going to believe this. Does this extended section capture the engaging, emotional tone you were looking for? Let me know if you'd like any tweaks." Rachel's mind was spinning. What on earth could be in her arm? The doctor's cryptic words had only fueled her growing anxiety. She tried to stay calm, but the sterile smell of the room, the steady beeping of the monitor, and the muffled voices of the medical team made it impossible to think clearly. The doctor, now visibly intrigued, leaned closer to inspect the object they had just glimpsed on the X-ray. He called in a second opinion, a colleague who specialized in unusual cases. Rachel couldn't help but notice the way they exchanged puzzled glances, their hushed voices making the moment feel even more surreal. "Rachel," the doctor began cautiously, "we're going to need to perform a deeper cleaning and some additional imaging to understand exactly what we're dealing with. Are you okay with that?" She nodded hesitantly. What else could she say? "Just, please tell me what's going on as soon as you know," she pleaded. The nurse smiled reassuringly as she adjusted Rachel's arm on the table. "You're in good hands," she said. But Rachel could hear the subtle undertone of curiosity in her voice too. Whatever was in her arm wasn't normal, and everyone in the room knew it. As the cleaning began, Rachel braced herself for the sting of the antiseptic and the pressure of the tools against her skin. The sensation was uncomfortable but manageable, until the doctor suddenly paused. "Interesting," he murmured, his brow furrowed. "Interesting," Rachel blurted out. "That's not exactly comforting." The doctor chuckled softly, trying to ease the tension. "Sorry, I didn't mean to alarm you," he said. "It's just, this doesn't feel like typical debris from a fall. There's something unusual about the way it's lodged in the tissue." Rachel's pulse quickened. "Unusual how? What does that even mean?" "It's hard to explain," the doctor replied, glancing at the nurse. "Let's take another look with ultrasound to get a clearer picture." The portable ultrasound machine was wheeled into the room, its screen flickering to life. Rachel watched nervously as the doctor applied gel to her arm and began moving the transducer over the wound. The monitor displayed a swirling mix of grays and whites, and to Rachel, it all looked like meaningless static. But the way the doctor's eyes widened told her everything she needed to know. "See this here," he said, pointing to a bright glimmering spot on the screen. "That's the object. It's definitely metallic, and it's not just sitting near the surface. It's embedded pretty deep." "Metallic?" Rachel exclaimed. "How could metal get in there?" "I didn't fall on anything metal." "That's what makes this so curious," the doctor admitted. "It's almost like it was implanted, but that wouldn't make any sense in your situation. You said you only fell, right? No other injuries or previous surgeries in this area?" "Oh, just the fall," Rachel replied, her voice shaking. "I don't even wear jewelry when I hike." The tension in the room was palpable. Even the nurse, who had likely seen her fair share of strange cases, seemed taken aback by the discovery. "It's almost like a foreign object that's been there longer than just today," she whispered, more to herself than anyone else. Rachel's stomach churned. "Longer than today," she repeated. "What are you saying? That this thing has been inside me for who knows how long?" "That's impossible." "We're not jumping to conclusions," the doctor said quickly, trying to calm her. "But we do need to approach this carefully. Whatever this is, we need to get it out without causing any further damage." The team prepped her for a minor procedure to extract the object. As the nurse administered a local anesthetic, Rachel tried to steady her breathing. "I can't believe this is happening," she muttered. "I thought I'd just get a few stitches and go home. Now you're telling me there's some mystery metal in my arm." "I know it's overwhelming," the nurse said gently. "But we'll figure this out together, okay? You're not alone in this." Rachel nodded, though her mind was still racing. She couldn't stop picturing all the worst-case scenarios. Was it a piece of a rusty nail? A shard of an old tool someone had left on the trail? Or, her imagination spiraled, was it something even more bizarre? The doctor made the first incision, working carefully to avoid any vital structures in Rachel's arm. Almost there, he said, his tone a mix of focus and anticipation. But as he worked, a faint metallic glint caught his eye. There it is, he murmured, his voice tinged with excitement. What is it? Rachel demanded, craning her neck to see. The doctor didn't answer right away. Instead, he carefully used a pair of tweezers to grip the object and began easing it out of her arm. The room was silent except for the sound of Rachel's rapid breathing. When the object finally emerged, the doctor held it up to the light, his expression one of disbelief. Rachel gasped. What is that? It's not what I expected, the doctor admitted, his voice barely above a whisper. I think you need to see this for yourself. The nurse grabbed a clean cloth to wipe the object, revealing a small, glimmering piece of metal. It wasn't a nail or a shard of scrap. It was something far more deliberate, almost decorative. Rachel's jaw dropped. That's jewelry. Not just any jewelry, the doctor said, examining it closely. This looks old. Very old. Rachel's mind reeled. How could something like that have ended up in her arm? And why now, after all this time, was it only being discovered? The doctor placed the object in a sterile container, his expression a mix of amazement and confusion. We'll run some tests to confirm, but I think this is going to be one heck of a story. Does this bring out the emotions, suspense, and realism you're aiming for? Let me know if you'd like any adjustments. The room fell silent as the doctor held up the tiny, glimmering object that had just been pulled from Rachel's arm. The metallic gleam caught the fluorescent light, casting small reflections on the sterile white walls of the ER. Rachel's heart pounded in her chest as she stared at it, her mind racing to make sense of what she was seeing. What is that? She managed to whisper, her voice shaky with a mix of fear and disbelief. The doctor turned the object over in his gloved hand, studying it closely. His expression was unreadable, a mix of fascination and confusion. This, he began slowly, almost as if he couldn't believe his own words, appears to be a piece of jewelry. A piece of jewelry? Rachel exclaimed, her voice rising in shock. How could that possibly end up in my arm? That doesn't make any sense. The nurse leaned in, her eyes wide with curiosity. It's not just any jewelry, she said softly, pointing at the object. Look at the design. It's intricate, like it's handcrafted. This doesn't look modern. Rachel felt a chill run down her spine. Handcrafted. What does that mean? Are you saying this thing is old? The doctor nodded, his brows furrowed as he continued to examine the object. It's possible. The design is definitely unique, almost antique. But how it ended up embedded in your arm is the real mystery. Rachel was utterly dumbfounded. Antique. This is insane. I've never seen anything like that before in my life. I didn't even fall on anything metallic, let alone jewelry. She felt her voice breaking, the surreal nature of the moment overwhelming her. The doctor placed the object into a small, clear container, sealing it carefully. We'll need to send this to a lab for further analysis, he said, his voice calm but tinged with intrigue. But there's no doubt, it's been in your arm for a while. The tissue around it suggests it wasn't lodged there today or even recently. Rachel's jaw dropped. A while. Are you telling me I've been walking around with this thing in my arm for weeks, months, years? The nurse tried to comfort her, placing a reassuring hand on her shoulder. Take a deep breath, Rachel. I know this is a lot to take in, but we'll figure it out. You're safe now. Safe, Rachel thought. How could she feel safe when she just discovered an antique piece of jewelry embedded in her own body? Her thoughts spiraled as she tried to piece together the puzzle. Had she unknowingly brushed past something sharp during a hike months ago? Could it have been there from an even earlier injury she'd forgotten about? The doctor interrupted her racing thoughts. You mentioned earlier that this trail is popular with hikers, right? Rachel nodded, her curiosity piqued despite her disbelief. Yeah, it's a pretty well-known spot. Why? The doctor hesitated, as though weighing whether to share his theory. Finally he said, it's possible this piece of jewelry was lost there by someone else, maybe a long time ago. The trail could have a history we're not aware of. You said you didn't fall on anything metallic, but what if the jewelry was buried in the soil or stuck in the rock where you scraped your arm? Rachel's eyes widened. You're saying this thing could have been there for years, decades even, and I just happened to be the unlucky one to, absorb it into my body like some kind of magnet. The nurse chuckled nervously, trying to lighten the mood. I don't think you're magnetic, Rachel, but stranger things have happened. The doctor, however, didn't laugh. He was deep in thought, turning to the nurse. Do you remember the case from a few years ago? The hiker who went missing on this same trail? The nurse's face lit up with recognition. Yes, I think her name was Emily or Emma. Something like that. She was reported missing for weeks before they found her backpack but never her body. Rachel felt her stomach drop. Wait, are you saying this piece of jewelry could belong to someone who never made it off the trail? The doctor nodded slowly. It's a possibility. The design of the jewelry could be significant. If it's an antique or a family heirloom, it might have been something that person was wearing when they went missing. We'll have to do some research to confirm, but it's a compelling theory. Rachel's mind was spinning. She had come into the ER thinking she'd need a simple bandage and maybe a tetanus shot. Now she was part of a bizarre medical mystery that seemed straight out of a crime thriller. What happens now? She asked, her voice trembling. We'll treat your wound and make sure there's no risk of infection, the doctor assured her. As for the jewelry, we'll report it to the authorities and have it analyzed. If it really does have a connection to that missing hiker, this could be an important clue. Rachel's emotions swirled, relief that her injury was being taken care of, fear about what this discovery might mean, and a strange sense of awe at the sheer improbability of it all. Rachel, the nurse said gently, her voice cutting through the whirlwind of thoughts, you might have just uncovered something that could bring closure to a mystery that's haunted people for years. That's no small thing. Rachel managed a weak smile. I guess I'll never look at hiking the same way again. As the medical team continued their work, Rachel couldn't help but stare at the small container holding the mysterious jewelry. It sparkled under the harsh hospital lights, a tiny glimmering enigma that had turned her ordinary day into an extraordinary story. Does this bring out the drama, awe, and emotional realism you were aiming for? Let me know if there's anything you'd like adjusted. And just like that, Rachel's hike turned into a story she'd never forget. A simple scrape unraveling a decades-old mystery. The discovery of the antique jewelry left everyone stunned, from the ER team to Rachel herself. It wasn't just about treating a wound. It was about uncovering a hidden piece of history, buried for years in the most unexpected way. Rachel's recovery was swift, but the impact of that moment stayed with her. It's a reminder that life can surprise us in ways we'd never imagine. What would you do if you were in her shoes? Share your thoughts below.